What it is, the Minister mentioned that she puts patients first, but she also is utilising the resources to the best advantage. Now, what I'd like to put to this panel is there are numerous people that are in hospital that have exhausted all their medical treatment. They are in pain. They have more or less got no hope. It is just a point of where they are waiting to die. I had the situation where my wife and father-in-law in the last 12 months, it occurred to both of them. My wife, it took 3 weeks for her to die. Father-in-law, it was 12 days. Now, what I'm suggesting is not euthanasia. I'm asking that this panel at least look at implementing some sort of working party whereby we can actually look at some sort of medical assisted dying. The reason being, the Minister mentioned how much money is being saved. These people, if someone's on life support, they could last up to a month. Others, it could be weeks. Now, it costs something like about $5,000 a day to keep those people there. I'm not talking about euthanasia. I'm talking about where all the treatment is stopped because there's nothing else available. The person is agreeable to this and their family members, and all we're asking for is that they be allowed to die in a dignified manner. Now, there's organisations out there, and when the surveys have been done, the public are 80% in favour of this. Unfortunately, any time you mention anything like assisted dying or euthanasia, they don't want to know about it, and especially the politicians. I've tried to put a submission in to the Senate committee, and it took me 3 goes to even get something in, and then they blotted out half of it anyway.
Thank you. First of all, I do sympathise with the position that you're in with your family. What you're really talking about is advanced care directives, where people give instructions about not having heroic interventions in the event of they're falling seriously ill, etc. Can I say, like my late mother gave the executor of her estate such an instruction, and the executor of the estate followed it, and that was me. It is not euthanasia. It is about not doing what she said, heroic interventions. Also, as well as that, we made a commitment about a year ago to develop a palliative care plan, which is about providing relief for those who are dying, whether it is in acute settings, but more appropriately, increasingly in the home. And can I tell you, we're about to land that policy plan with some funding arrangements over the next few weeks. You've raised an extremely important issue. I think it's the kind of debate that we need to have out in the community about encouraging people to have these conversations as a family and to make their views known through their GPs, through those treating them, because you're right, it is not a dignified way to die, and it's not an appropriate way to die. I get so many complaints from people running intensive care units that they've really turned into palliative care units rather than units where they originally were intended for people to spend a short time while they recovered before going on to other care. So thank you for raising the question. Watch out for the palliative care plan.
With the palliative care, what I'd like to see implemented, if possible, and you've touched on it, that you bring in another stage of it, that for the terminally ill, we look at another stage where that can be.
There will be, it's quite a comprehensive plan. It will map where the services are needed through the state, and I'm very enthused by the response that we've had to a variety of participants in forums we've had about palliative care that will be comprehensive, and a whole lot of stages and a whole lot of settings. So thank you for that.
Thank you. And as far as that working committee, Minister, there's organisations already at present, Dying with Dignity, there's Christians and all this. So could we see if we can at least implement some sort of working committee?